The Omicron variant has been causing a surge in COVID outbreaks across the country, and the Surgeon General says we're still weeks away from hitting its peak. Dr. Salim Surani joins us live to discuss this further. Dr. Surani, always a pleasure seeing you. Thank you for being with us. Since the start of this pandemic, 1 in 5 people have been infected with COVID. And this weekend, Dr. Fauci said that everyone will be touched by this. Are we starting to see a decline? Do you think that still holds true, that 1 in 5 will still be affected?
Good morning, John. Glad to be. The thing is, the number of 1 to 5 is way underestimation because this is the people we are seeing who have been checked, especially with the Omicron. It's a lot of the people may be infected, but if you don't check it, you won't know it. So the number of the people infected would be actually much higher than that. But the good thing is, this is much wilder variant. Would everyone be touched with this thing? They've already been touched. Everyone knows a friend, family member, or relative, or even a part of their household have been infected. And it's going to continue to do that. And one of the things is that, in the past, we thought like, okay, once you get the infection, you get an immunity and you will get the herd immunity. And that's how we are going to do better. But what we have realized is that the variants are smart. They're able to bypass that. And even the people who have been infected, they can get reinfected. And even people who have been vaccinated, they can get a breakthrough infections too. So I think one thing I agree with Dr. Fauci is this virus is not going to go anywhere. I think what we hopefully are seeing is the end where the virus is trying to compromise. That's what they do. They become more transmissible and they become less lethal. And in other words, every year, somehow or the other, they come with a different variant. And what I expected that every year it's going to be like a flu where we get the vaccination and then hopefully that can help prevent the serious illness, because in flu, we try to prevent the infection with vaccination, but the main purposes for vaccination is that we can try to prevent the people from getting sick and in hospital. And if they get infections or something like that early in this stage, we have the pill to treat it. That's exactly the same thing we are following with the Omicron or the COVID-19.
Well, Dr. Surani, does that mean that it's time to start talking about annual boosters? Are we even talking about a 4th booster at this point?
Yeah, one of the things is the 4th booster for the Omicron is coming in March. The question is that would it be a last variant? So I think WHO has said very clearly we need to have a booster which has a multi-range of coverage where it can cover the variant circulating and the possible other variants where they can act on. So in other words, you want something like the big bomb, which is it's like a shotgun approach. You can kill a lot of those things rather than a very precision guided therapy, because if we know that the variants are going to come in, this is not one of the last variants, but we hope that every other variant coming by is much less lethal and less transmissible than what we are seeing.
Dr. Surani, as always, we appreciate your insight. You're going to be with us in the next half hour discussing this more with Barbie. If you have a question and you'd like it answered, please send us a text at 361-855-6397.